Welcome back. It's time now for Viewpoint, and today we assess the pandemic situation here and elsewhere amid conflicting strategies and situations among countries. For more, I have Professor Howard Lee from Seoul National University. Professor Lee, it's been a while. Welcome back.
Thank you for having me today.
I also have Professor DAVID KWAK from Soon Chun Hyang University. Professor KWAK, welcome back.
Good afternoon.
Professor Lee, since it's been a while, maybe we could start with you with an assessment perhaps of Korea's current COVID-19 situation.
It looks like the worst has passed. For example, the daily new case of infection per population has decreased to approximately 8% of the peak time, which was several weeks ago. However, it's too early to let go and get relieved. For instance, the ICU admission per population, which reflects the severity of the COVID-19 cases, is still relatively higher than that in other countries. So we have to be careful about that.
Right, we have to be more vigilant then. And Professor KWAK, given the current status quo then, with regard to our COVID-19 situation, what do you suppose would be wise with regard to quarantine guidelines for COVID-19 patients here in the country?
Well, so I think what you're asking is whether or not we should actually lift the quarantine measures that we're currently mandating for everyone who are infected. Well, you're asking a clinical physician. So in my personal view, I am the most conservative person in approach to really dealing with any kind of infections, especially when it comes to a disease that can cause death. Quarantine, I think, should still remain mandated, especially when we're facing, in the near future, possibly considering changing the test for people who are entering the country from having been tested through PCR tests. Now, most likely to be changed to antigen test. That being possibly creating more chances for false negatives. People who are actually infected, not screened through the process, could enter more easily. I think will be affected by what happens globally much more easily in the near future as well. So if we start to, let's say, lift up the quarantine mandates altogether, at the same time we're opening more to the global community, it is more possible that we'll be much heavily affected by those neighboring countries or any other countries that would still be affected by resurgences. And those resurgences will not necessarily come from the original strains of COVID-19 that we've had before, but those will happen from newly appearing subvariants, such as the BA4, such as the BA5, and possibly even more new subvariants as well. And we do not know currently whether or not those could also cause severe cases. What we're mainly concerned with is that through the past huge wave, we've noticed that the severity and the death rate significantly reduced compared to the prior waves. And I'm hoping dearly that it'll stay that way. But if we were to be faced with, let's say, sadly, a severe causing new variants, but we're completely open to it, and where everybody's exposed because they're not mandated to quarantine, will obviously be in a much more dangerous situation, not just for the individuals who are infected, but also population-wise, epidemiologically speaking. So I think it's still too premature to really talk about completely lifting up the mandates for quarantine. I think we should keep the bare minimal distancing guidelines that we can, but still have the economy going as we can. We're having going through with mandating of lifting of the mandates for the masking on the outside and etc.
Right. So a 7-day quarantine for COVID-19 patients here in the country.
I hope so.
Professor Lee, starting Monday, Pfizer's Paxlovid is being offered to teenagers and adults with pre-existing health conditions here in the country. What are your thoughts on this expanded use of Paxlovid?
I want to see that as a positive sign because it simply reflects the drug has been more available right now in South Korea compared with early this year. So that's a good sign. But also I want to focus on the use of Paxlovid in teenagers and children. As you said, starting May 16, teenagers ages 12 and up can get Paxlovid if they have underlying diseases such as cardiovascular diseases, chronic lung diseases, and diabetes. And this measure is not totally unexpected because the emergency use authorization conditioned by the MFDS, the regulatory agency in South Korea for Paxlovid, says that it can be prescribed to children ages 12 and up. Actually, this age group has not been tested in the original clinical trial with Paxlovid, but Pfizer, the developer of Paxlovid, embarked on a new clinical trial in children and teenagers ages 6 to 17 to study the efficacy and safety of Paxlovid in that age group. Of course, we're still waiting to see the results, but putting all the data available with regard to the exposure to Paxlovid, it looks like the systemic exposure to Paxlovid in teenagers and children is much more similar to that in adults. So having said that, I think Paxlovid can be safely used to curb the symptoms of COVID-19 in children.
Right, who have pre-existing conditions, of course. Professor Kwak, starting next Monday, as you mentioned earlier, negative rapid antigen tests will be accepted when choosing to enter South Korea. What are your thoughts on this ease in border restrictions?
Well, I'm sort of ambivalent towards the changes in the measure. Number one, PCR tests would obviously provide much stricter screening capability from us, blocking out any, even the slightest chance of a person who's infected to enter the country. So it'll, in a sense of direction, it'll directly protect us from having a person who's infected to come into the country better compared to having them being screened through the antigen test, let's say. But on the other hand, antigen test provides much fluency, meaning people who need to enter could possibly be tested through. And currently we know through the Omicron variant, it doesn't necessarily cause severe cases of disease, let alone much less mortality as well. So I think at this stage, antigen tests, having people entering the country being screened through antigen test would suffice. But I want to limit it to the time being because, as I've said before, in such cases where a new variant starts to cause higher severity and also higher mortality, that would be the time period where we would probably need to go back to a much stricter screening process to directly protect us from having any exposure to someone who's infected to come into the country. Now, comparing antigen test and the PCR test is like the 99.99% accuracy test. Antigen test, on the other hand, creates a lot of false negatives. But at this point, as I said, because it is the current most common variant is not known to cause any severe, well, not any, but relatively speaking, less severe diseases and also less mortality. We are currently saying that we may let this go a little bit and sort of take into consideration that there would be few cases where people are exposed to those who are infected entering the country. But as I said, once it starts going back to possibly causing more severity, then we should probably go back to PCR testing as well.
Right, and then tighten our border restrictions then. Professor Lee, moving on to the vaccination front, there is quite a bit of talk about the efficacy of second booster doses. Where do you stand on this debate?
Well, I strongly support second booster injection, particularly for those who are over 50 and got their first booster at least 4 months ago. And also immune-compromised individuals, irrespective of their age, are also strong candidates for second booster. Cumulative evidence has shown that vaccine efficacy against COVID-19 and its related hospitalization is waning within 2 to 5 months after a first booster dose, especially for the Omicron variant. Not only that, emerging evidence also suggests that a second booster dose of a messenger RNA vaccine can improve protection against severe COVID-19, and that is not associated with any new safety concerns. So again, I think the second dose shot is a must.
Right. And now, Professor Kwak, let's address the pandemic situation beyond national borders. As my colleague Min Soo-kyun mentioned earlier, North Korea is witnessing that is an explosive outbreak of fever cases, which is suspected to be COVID-19, but has yet to be confirmed because of their testing capacity. Do you share this outlook that the situation over in North Korea may spiral out of control?
Well, I actually personally think that it is already out of control. They're lacking the vaccines up front, and then they're also lacking any sort of medications to treat the patients. To the best of my knowledge, they're also lacking symptomatic medicines as well. So they're importing those what are necessary from overseas, except I guess those countries that they are against. So the situation is already quite dire, and it's quite worrisome. The most thing I'm quite worried about is the fact that the most of the population that are going through the pandemic now haven't been vaccinated. So this Omicron variant is not currently well known on how much of the severity it can cause to people who are naively infected, meaning those people who have not been exposed to COVID-19 even distantly before and also have not been vaccinated. So we have to watch very closely what it caused there. But I think as a brother country, as a cousin country, I think we should prepare also to help them if they need through whatever process that we can support them to save lives, really, because these are not political people who are being affected. Those are regular citizens and regular people, just like us, who are possibly dying from the disease. So I think we need to also prepare for possible help we can. If we can lay our hand to them.
Right. Well, we have extended, we have talked about intentions to help them, but they have yet to respond to our support. But they have reached out to China and Russia. Now, North Korea, Professor Lee, reportedly is rejecting vaccine support and instead calling for treatment. How do you explain this stance?
Well, I think there are several possible explanations. First, the North Korean regime appears to think allowing vaccines to be introduced to North Korea is a sign to let foreign countries dominate over the regime itself, which can be a threat to the wholeness and sovereignty of the nation. Second, there is no infrastructure at all, such as cold chain logistics for vaccination. So even though the vaccines are available, there is no way that can embark on a nationwide vaccination program in North Korea currently. Thirdly, I think since the Omicron variant has been rampant in North Korea already, there are so many people who need to be hospitalized. So in that case, they need treatments instead of vaccination. So I think all those things collectively facilitate North Korea to ask for treatments instead of vaccines.
Right. And elsewhere, Professor Kwak, South Africa, that is noting a dramatic rise in case counts, especially among people who have immunity against the virus through a natural infection or vaccination. How worried should we be about this reality?
So when I looked into the matter, it seemed like South Africa, among many other countries who are going through another resurgence in their countries, are mainly having subvariants of BA4 and BA5 constitute the newly occurring infections. And currently being studied as up to date, it is known to be able to sort of evade the prior immunity people might have gotten either through vaccination or through prior infections. And that's what's worrying a lot of medical personnel all over the world. But another thing that I also noticed is the fact that those countries currently being said to be affected by these variants are namely two countries, Portugal and South Africa, did go through prior waves of their pandemic about 5 to 6 months before. And many other countries have their own peaks of waves about sometime in between of those time and now, meaning other countries that are not currently having as big of a resurgence did have their own waves, let's say 2 to 3 months back. In our own case, we had our peak of the wave about a couple months back also. So I personally hope and predict that we won't be heavily affected by these variants. But scientifically speaking, currently being studied, the BA4 and BA5 being able to evade prior immunizations, there is still possibility it will be able to affect the global community, let alone the Korea, in the near future. So we should keep a close eye on it, but we should also possibly think about how we could immunize ourselves against even further occurring subvariants as well.
Right. And Professor Lee, neighboring China remains committed to its zero COVID policy despite the global health body's doubts about its sustainability. What are your thoughts on this?
Not only WHO, the World Health Organization, many, including myself, are very doubtful about the effect of the so-called zero COVID policies strictly implemented in China. China is the world's biggest country, and I don't simply understand how this gigantic country could 100% prevent COVID-19 from being transmitted from one area to another by simply locking down the whole cities and regions. Besides, some of those zero COVID policies are inhumane and sometimes unethical. No civilized country sustained that kind of zero COVID policies forever, and China is not an exception.
Right, I see. And Professor Kwak, back here in the country, with regard to COVID-19 strategies then, the Yoon administration has spoken about having a COVID-19 strategy that is based on science. Now, that being said then, Professor Kwak, what scientific basis would be crucial to allow for the lifting of face masks indoors?
There will be I guess there would need to be a huge scientific background to actually start allowing people to not wear a mask inside. Number one, obviously, there needs to be a scientific proof that people will not be infected despite taking off their mask indoors. There also needs to be proofs, strong proofs, that taking off the mask indoors will not cause more severe and more deaths than before when we were wearing masks. So in that regard, in retrospectively speaking, I don't think there's a great chance that we would start to lift the mandates for wearing the mask indoors at least for the time being, and not just in the near future, because what we're currently seeing is that through wearing the mask indoors at least, we're not only protecting ourselves from getting infected with COVID-19, but also with many other diseases as well. And it's quite beneficial for especially respiratory infected diseases. So I think, sadly speaking, we're going to see wearing the mask indoors at least for a little more while.
Right, I see. And Professor Lee, do you believe Korea is poised to mark a resurgence, which is something that Professor Kwak touched upon earlier? And if we do have a resurgence in the near future, Professor Lee, do you suppose it would be severe or mild?
Well, looking back, the previous several waves of COVID-19, and I think Korea will enter a resurgence sooner or later. To me, it's not a matter of if, but a matter of when. Professor Kwak already mentioned about the newly found variants, BA4 and 5, and then those variants have been identified in South Africa mostly. And these variants are slightly more transmissible than the Omicron variant. Additionally, these new variants can dodge some of the immune protection conferred by previous infection and vaccination. So I think it will come again. I don't know it will exactly, but it can be soon. And the severity at this point, I don't have any crystal ball, but I hope and pray that it's going to be lesser than we underwent.
We hope so too,
Yeah.
of course. Professor Kwak, when do you suppose, this is going to be a really tough question, that's a multi-million-dollar question, when do you suppose will this pandemic end?
Well, as we have seen through prior waves, we started noticing that more and more resurgence occur, less severe and less mortality it starts to cause. And we're already currently seeing around us that people are living their lives as if we are prior pandemic. So I think, officially speaking, I don't think the word pandemic will possibly ever go away. We can't really title ourselves to be over the pandemic at any time soon. But realistically speaking, in the real world, we are already having sort of our foot inside the door to the post-pandemic era, where we consider COVID-19 to be not as the severe disease that we used to have before, but more like a common flu type of a deal, where we could possibly get infected and get away with it, or possibly we could protect ourselves from it by being injected with immunizations and whatnot.
Right.
So I'm thinking pandemic, not in the title, but in the real sense, realistic sense, I think is already in the progress of getting eradicated.
Right, okay, I see. All right, Professor, thank you so much for your thoughts today. And Professor Lee, thank you as well for your insights.